What if the food sitting in your kitchen right now, food you've probably eaten your whole life, or maybe avoided for the wrong reasons, could quietly bring your blood pressure down by 10, 15, even 20 points without adding a single new medication? What if the reason most men over 60 are still struggling with high blood pressure has nothing to do with willpower, genetics, or even age, but with 5 specific dietary decisions that almost no one is telling you about clearly enough? Here's a number I want you to sit with for a moment. The CDC reports that nearly 75% of men over the age of 65 in the United States have hypertension. 3 out of 4 men your age. And here's what makes that number dangerous. The American Heart Association estimates that nearly half of those men don't have it adequately controlled, even with medication. That means millions of men are walking around right now with blood pressure that is silently damaging their arteries, quietly stiffening their heart muscle, slowly reducing blood flow to their brain. And they feel fine. They feel completely fine. I've been practicing medicine for over 20 years. I've sat across from thousands of men between the ages of 55 and 80. And I'll tell you what I tell every single one of them. High blood pressure doesn't warn you. It doesn't knock. It just takes. It takes your sharpness. It takes your independence. It takes your ability to drive yourself to your grandson's baseball game, to think clearly in the morning, to feel like yourself. And today, in the next 18 minutes, I'm going to give you 5 food-based strategies that are backed by serious clinical research from institutions like Harvard, the Mayo Clinic, the NIH, and the Cleveland Clinic that can genuinely move the needle on your numbers. And I'm saving the most powerful one, number 1, for last. Because when I explain the science behind it, I think you're going to realize you've been doing the opposite of what actually works. And that reversal, that's where the real results come from. Stay with me. My name is Dr. Adrian Solberg. I've spent 2 decades specializing in male aging, vascular health, and the intersection of nutrition and cardiovascular function in men over 55. I've treated men who were athletes in their 40s, now surprised that their blood pressure is climbing in their 60s. I've treated men who ate pretty healthy their whole lives and still ended up on 3 blood pressure medications. And I've treated men who made targeted, specific dietary changes, not overhauls, not rabbit food diets, and watched their systolic pressure drop 12, 14, even 18 points within 8 to 12 weeks. The patterns I've seen over 20 years are consistent. The mistakes are predictable, and the solutions, honestly, are more accessible than most men realize. Before I get into the 5 strategies, I want to ask you something directly. Right now, do you actually know what your blood pressure was at your last checkup? Not roughly, specifically, the top number and the bottom number. Drop it in the comments below. Even if it's just, I don't know, that's important information too. Because men who track their numbers are statistically more likely to take meaningful action. And I want to know where you're starting from. Write it in the comments. I read them. My team reads them. And your answer might help another man in this community take his health seriously too. I want to tell you about a patient I'll call Gerald. He was 68 years old when he first came to see me. Retired engineer, sharp man, proud man. Gerald had been noticing that his mornings felt heavy, a dull pressure behind his eyes, some fogginess that he assumed was just getting older. He'd mentioned it to his previous doctor, who told him to reduce stress. So Gerald figured it was just aging. He kept moving, kept ignoring it. When we ran his numbers, his systolic blood pressure was 158 millimeters of mercury. His diastolic was 94. That's stage 2 hypertension. His kidneys were already showing early signs of stress. His carotid arteries had measurable stiffening on imaging. He was 68 years old, and his vascular system was behaving like a man of 78. Gerald didn't want more medication. He was already on 1 antihypertensive, and he hated how it made him feel. So we talked about food, Specifically, we talked about 4 of the 5 strategies I'm sharing with you today. Within 10 weeks, his systolic dropped to 138. Within 16 weeks, it was 131. His kidney markers improved. His morning fogginess almost gone. He looked at me in that follow-up appointment and said something I've never forgotten. "Doc, I thought I was just getting old. I didn't realize I was getting sick." That sentence. That's why I make these videos. Because Gerald isn't rare. Gerald is sitting in living rooms across this country right now, thinking his symptoms are just aging. And I need you to hear this clearly. Feeling okay is not the same as being okay. Let's get into the 5 strategies. And we're going to start with number 5, because this is where most men make their first mistake. And it's a mistake that costs them months of progress before they even realize it. Strategy number 5, reduce ultra-processed sodium, not all salt. Most men I talk to have already heard, cut the salt. So they stop using the salt shaker at dinner, feel like they've done their part, and wonder why their blood pressure hasn't budged. Here's where most men get it wrong. The American Heart Association has published data showing that approximately 70 to 75% of the sodium in the average American diet doesn't come from the salt shaker. It comes from processed and ultra-processed foods, canned soups, deli meats, packaged breads, frozen meals, condiments, fast food. The salt shaker is not the enemy. The food manufacturing process is. Think of your arteries like a rubber garden hose. When sodium levels stay chronically elevated, your body retains more water to dilute it. And that extra fluid volume is like turning up the water pressure inside that hose. Not a little, significantly. A landmark study published in the New England Journal of Medicine, supported by research from Harvard School of Public Health, estimated that reducing dietary sodium by just 1,000 milligrams per day could prevent up to 92,000 deaths annually in the United States alone. That's not a small number. That's a city. Here's what I want you to do. For the next 2 weeks, don't touch your salt shaker. Instead, read 1 label per day on packaged food. If a single serving contains more than 400 milligrams of sodium, put it back. Focus your reduction there. That's where the real sodium is hiding. And speaking of things hiding in your food that you don't expect, strategy. Number 4 is one that surprises almost every man I've ever sat across from. It involves something most men actually think is healthy, but they're only getting half the story. Strategy number 4, increase dietary potassium, strategically. Most men have heard of potassium. Most associate it vaguely with bananas and leg cramps. Few men over 60 understand that potassium is one of the most powerful natural pressure regulators in the human body, and most aging men are profoundly deficient in it. Here's what's actually happening inside your body. Sodium and potassium operate in a biological opposition system inside your cells. Potassium signals your kidneys to excrete sodium. When potassium is low, sodium accumulates. When sodium accumulates, blood pressure rises. It's a direct relationship, and most men are only addressing one side of it. The NIH Office of Dietary Supplements reports that the adequate intake for potassium in adult men is 3,400 milligrams per day. Studies consistently show that most American men consume less than 2,500 milligrams. That's a gap of nearly 1,000 milligrams daily. And that gap has a direct cardiovascular cost. Think of sodium and potassium like 2 engineers running your body's pressure control system. Sodium is the one who wants to tighten the pipes. Potassium is the one with the release valve. When potassium is undermanned, the pressure builds and nobody's opening the valve. A meta-analysis published in the British Medical Journal, analyzing 33 randomized trials, found that increased potassium intake was associated with a mean reduction of 3.49 millimeters of mercury systolic and 1.96 millimeters of mercury diastolic blood pressure. In men with hypertension, those numbers were significantly higher. The Mayo Clinic identifies potassium-rich foods including sweet potatoes, white beans, spinach, avocado, salmon, and yes, bananas, as foundational to a blood pressure-reducing diet. Here's your action step. Add one high-potassium food to 2 meals per day. A half cup of white beans contains over 500 milligrams of potassium. A medium sweet potato contains over 900 milligrams. These aren't supplements. This is food. Real, accessible, affordable food. But potassium works even better when you understand what I'm about to show you in strategy number 3. Because one thing you're probably drinking every day is actively working against everything else you're trying to do. Strategy number 3. Address what you're drinking, not just what you're eating. Blood pressure conversations focus almost entirely on food. But for men over 60, what you drink, specifically how much and what kind, has a measurable and often underestimated impact on your vascular pressure. Here's what's happening. Chronic mild dehydration, which is extraordinarily common in men over 65 because the thirst sensation weakens with age, causes the blood to thicken slightly and the body to compensate by constricting blood vessels. Constricted vessels mean elevated pressure, and most men don't even know they're dehydrated because they stopped feeling thirsty the way they used to. Research from Johns Hopkins Medicine has consistently shown that alcohol consumption above 2 standard drinks per day raises blood pressure meaningfully, and the effect is more pronounced and sustained in men over 60 than in younger adults. A 2021 study published in JAMA Network Open, drawing on data from over 17,000 participants, found that reducing alcohol intake was associated with statistically significant reductions in both systolic and diastolic blood pressure, even in men who were considered moderate drinkers. Separately, Cleveland Clinic cardiologists have noted that caffeine, particularly in high amounts, can cause acute spikes in blood pressure, especially in men who are already hypertensive and less metabolically adaptive due to age. Think of your blood as the fluid in your engine. If that fluid gets too thick, or if you're adding compounds that inflame the system, your engine has to work harder to pump it through. Over time, that extra effort, that chronic strain, shows up in your blood pressure readings. Here's what to do. Aim for 6 to 8 8-ounce glasses of water daily. If you drink alcohol, keep it at 1 drink or less per day. If you drink more than 2 cups of coffee, consider shifting the second or third cup to an earlier time in the morning to reduce afternoon pressure spikes. Small adjustments. Real results. I want to pause here for a moment. We're halfway through, and I know some of you watching right now might be thinking, I've heard some of this before. Maybe you have, but I want you to ask yourself honestly, have you actually implemented it consistently for more than 2 weeks? Because the men I see who struggle with blood pressure aren't usually uninformed. They're inconsistent. And inconsistency with hypertension isn't just frustrating, it's physiologically costly. Every week of uncontrolled high blood pressure is another week of arterial wall stress, another week of micro damage to the small vessels feeding your brain and kidneys. I'm not saying this to frighten you. I'm saying this because you deserve honesty. You've earned it. The next 2 strategies, particularly number 1, are where I've seen the most dramatic clinical results in my patients. Men who implemented these 2 things saw changes that surprised even me. Don't go anywhere. Strategy number 2, eat more nitrate-rich foods for vascular elasticity. When men hear the word nitrates, they think of deli meat preservatives, something bad, something to avoid. And I completely understand why, because that's what most health messaging has told you. But this is one of the most damaging nutritional misconceptions I encounter in men over 60, and I need to correct it directly. Dietary nitrates found in whole plant foods are profoundly different from synthetic nitrites used in processed meats, and they are among the most clinically validated natural blood pressure interventions we have. This is not opinion. This is published, peer-reviewed science. Here's what's actually happening when you eat these foods. When you consume natural nitrates, found abundantly in beets, leafy greens like arugula and spinach, and celery, your body converts them through a biological pathway involving oral bacteria and stomach acid into nitric oxide. Nitric oxide is a vasodilator. It signals the smooth muscle lining your blood vessel walls to relax and expand. When your vessels expand, pressure drops. It's that direct. It's that powerful. Think of your arteries like steel pipes that have gradually narrowed over decades. Rust, plaque, stiffness. Nitric oxide is like a chemical softener applied to those pipe walls from the inside. It doesn't remove the rust, but it makes the pipe more flexible, more responsive, more capable of handling flow without pressure buildup. A landmark study from Queen Mary University of London, published in the British Heart Journal, found that drinking 1 cup of beet juice daily for 4 weeks lowered systolic blood pressure by an average of 8 millimeters of mercury in hypertensive patients. That is clinically meaningful. That is medication-level movement from a cup of beet juice. The NIH has further validated that inorganic nitrate from vegetables is metabolically distinct and beneficial, particularly for aging men whose endothelial function naturally declines with age. I wish someone had told me this earlier in my career. I spent years focused almost exclusively on sodium reduction with patients. The nitric oxide pathway, the vascular elasticity angle, was underemphasized in my early training. Now, it's one of the first conversations I have with every hypertensive man over 60 who walks into my office. Here's your action step. 3 to 4 times per week, include one of the following at a meal: 1 cup of cooked beets or 8 ounces of beet juice, 2 cups of raw arugula or spinach, or 4 stalks of celery. These aren't exotic foods. They're at every grocery store, and their vascular impact is real. Now. Number 1. This is the one I've been building toward. And when I explain the full mechanism, the reason most men are unknowingly counteracting every other healthy thing they do, I think you're going to look at your daily routine very differently. Strategy number 1. Rebuild your magnesium intake, the silent pressure regulator that most men are completely deficient in. Here's the myth reversal I saved for last. And it's the one that matters most. Most men trying to lower their blood pressure with food focus on what to remove: less sodium, less alcohol, less caffeine, less processed food. And yes, all of that matters. But what almost no one tells you clearly enough is what your body desperately needs more of, and is almost certainly not getting, to regulate blood pressure at a foundational cellular level. That nutrient is magnesium. Magnesium is involved in over 300 enzymatic processes in the human body. Among its most critical roles, regulating the sodium-potassium pump inside your cells, modulating calcium channels and vascular smooth muscle, and directly supporting the production of nitric oxide, the same vasodilator we just discussed in strategy number 2. When magnesium is insufficient, calcium floods into vascular smooth muscle cells unchecked. Calcium causes those cells to contract. Contracted vascular smooth muscle means narrowed blood vessels. Narrowed blood vessels mean elevated blood pressure. Here's the devastating part. The NIH reports that approximately 48% of Americans do not meet the daily recommended intake for magnesium. In adults over 60, that percentage is even higher, because magnesium absorption in the gut declines with age. Many medications common in older men, including certain diuretics and proton pump inhibitors, deplete magnesium further, and the kidneys become less efficient at retaining it. This isn't a fringe theory. This is established, peer-reviewed physiology, and it's being missed in millions of men right now. Let me give you the research, and I'm going to give you 3 sources because this point deserves that weight. First, a meta-analysis published in the journal Hypertension, examining 34 clinical trials and over 2,000 participants, found that magnesium supplementation produced a mean reduction of 2.00 millimeters of mercury systolic and 1.78 millimeters of mercury diastolic blood pressure, with significantly greater effects in participants who were already deficient. Second, researchers at Harvard T.H. Chan School of Public Health analyzed data from multiple large cohort studies and concluded that higher dietary magnesium intake was consistently associated with lower risk of hypertension, cardiovascular disease, and stroke, independent of other dietary factors. Third, the World Health Organization has formally recognized magnesium deficiency as a global health concern with direct cardiovascular implications, particularly in aging populations. Think of magnesium as the master electrician in your body's control center. Your vascular system runs on electrical signals, signals that tell blood vessel walls when to contract and when to relax. Magnesium is the insulation on those electrical wires. When it's depleted, the signals fire incorrectly. Vessels stay tighter than they should be. Pressure builds. And no amount of sodium restriction fully compensates for that underlying electrical dysfunction. Now, here's exactly what to do. 3 steps. Simple. Actionable. Starting this week. Step 1, food first. The richest dietary sources of magnesium include dark leafy greens, particularly cooked spinach, where 1 cup contains approximately 157 milligrams. Pumpkin seeds, 1 ounce contains 156 milligrams. Dark chocolate above 70% cacao, 1 ounce contains approximately 64 milligrams. Black beans, almonds, whole grains. Target 400 to 420 milligrams daily. The RDA for men over 30 per the NIH. Step 2. Assess your medications. If you are on a diuretic, a proton pump inhibitor, or certain diabetes medications, speak with your physician specifically about whether your magnesium status has been assessed. A standard blood panel often misses magnesium deficiency because only 1% of the body's magnesium is in the blood. Ask specifically for a red blood cell magnesium test. It's more accurate, and it's the test that actually tells you what's happening at the cellular level. Step 3. Consider supplementation strategically. If your diet is consistently low and your physician confirms deficiency, magnesium glycinate or magnesium malate are the forms with the best absorption and the least gastrointestinal side effects. Start low, 100 to 200 milligrams in the evening, and increase gradually under medical guidance. When magnesium is restored, when your vascular electrical system is properly insulated again, men describe it as feeling like they've turned a dimmer switch back up. Clearer mornings, less tension, better sleep, lower readings. Gerald, the patient I told you about earlier, his magnesium was low. It was one of the first things we corrected. Within 6 weeks of dietary adjustment and a physician-supervised supplement, his numbers began their meaningful descent from 158 systolic to 131. Without a new medication, with food, consistency, and the right information. This is not magic. This is biochemistry, and you deserve to have it explained to you clearly. Now, let me give you a simple daily system. You don't need to overhaul your life. You need a repeatable framework that fits into the life you already have. Every morning, drink 12 to 16 ounces of water before your coffee. Include 1 magnesium-rich food at breakfast, a handful of almonds, spinach in your eggs, pumpkin seeds on your oatmeal. If you monitor your blood pressure at home, take it now. Seated, rested, same arm, same time every day. Every afternoon, read the sodium label on 1 packaged food item, just 1. This builds the habit without the overwhelm. Include 1 potassium-rich food at lunch, half a sweet potato, white beans, avocado. If you drink alcohol, save it for the evening and keep it to 1 drink. Every evening, include a nitrate-rich food 3 to 4 times per week at dinner. Beets, arugula, spinach, celery. If you're supplementing magnesium, take it at bedtime. It also supports sleep quality in aging men. And drink a final glass of water to counter the mild overnight dehydration that's natural with age. Every week, review your blood pressure log and look for trends, not single readings. Discuss any consistent readings above 140 over 90 with your physician, and celebrate small drops. A 5-point reduction in systolic pressure matters. It reduces stroke risk. It matters more than most men realize. Tonight, before you go to bed, I want you to think about what you're actually protecting here. You're not protecting a blood pressure number. You're protecting your ability to drive yourself to your appointments. You're protecting the clarity that lets you make sharp decisions in the morning. You're protecting the strength to walk your dog, carry your groceries, stay in your own home on your own terms. High blood pressure, left unmanaged, is one of the leading causes of cognitive decline in men over 65. It damages the small vessels feeding your brain, the ones responsible for memory, processing speed, and judgment. This isn't abstract. This is your independence we're talking about. The 5 strategies I gave you today, reducing ultra-processed sodium, increasing potassium, managing what you drink, adding nitrate-rich foods, and rebuilding your magnesium, these are not miracle cures. They are evidence-based, clinically validated, accessible tools. And when applied consistently, they work. You don't have to do all 5 perfectly on day 1. Pick one, start tomorrow morning, build the system one piece at a time. Gerald did. And Gerald is 71 now, driving himself everywhere, sharper than he's been in years, and managing his blood pressure without adding a single new medication. That's what this is for. If this video gave you something useful, something you hadn't heard explain this clearly before, share it. Send it to your brother, your friend, your father, the man in your life who's been brushing off his blood pressure numbers. Drop your numbers in the comments. Tell me what you're going to start with. Tell me what strategy surprised you most. I want to hear from you, and if you haven't subscribed yet, this channel is built for men like you. Real medicine, real data, no gimmicks. Every video is designed to give you the information your doctor would give you if he had 20 uninterrupted minutes and no waiting room behind you. Subscribe, hit the bell, because the next video may be the one that changes something important for you. I'm Dr. Adrian Solberg. Stay sharp, stay strong, and take control of your health. I'll see you in the next video.